Shalom, everybody. And I know I've been off for a while. Um, Give me 1 second. I'm gonna go get some stuff real quick. Hold on. All right. Like I said, I don't expect anybody to join this live or anything like that. I've been live for a minute. Uh, it has been one heck of a month, guys. One heck of a month. So, as a few of you might know already, most of you don't know, I almost passed away yesterday. Um, I've been having a few health problems, some stuff that the doctors did. Um, and I just want to talk about that real quick. Um, so it all started out with me going in for a previous injury or whatnot, and it's been some stuff that's been going on with my leg and my foot. So I decided that I'm going and get it get checked out and see what's going on. Now, as most of you guys know, I have been talking about this for a while about how doctors and these hospitals in particular, they're designed to keep people sick. Okay. Doctors and hospitals do not help you. And I'm going to explain this because it's a firsthand account, right? So I was in the hospital recently, and this month I've been in the hospital more than I have ever been in my life. Okay. So hold on. I gotta go grab this stuff real quick. Hold on. All right. Let me just let me show you this real quick. Oh, I forgot I can't flip my camera. But yeah, so I got a stack of papers here. I'm gonna read this stuff to you guys. Okay. So my first little the original problem was, I basically had pinched a nerve in my foot, and that's what I originally went in for. Okay. So the first thing I went in for was toe pain, right? It's the first thing I went in for. So I got discharged and I was supposed to go follow up, which what I did. They gave me ibuprofen, told me to stay off my leg for a few days, right? And that was the first thing, right? So this was on 5/21/24, right? That was the first visit. I didn't go back in until this year, beginning of this month on the 8th, right? This time it went whatever happened, which I found out is varicose veins or whatever, because I was looking it up. But anyway, so I go in on the 8th because it got worse. So instead of it being at my toe, at now it's now it's my foot and it's my knee. Okay. So I go in again, right? And So my diagnosis was chronic pain in the right knee, right ankle pain, blah, blah, blah. Did another follow up, was given instructions, do this follow up. And like doctors always do, they throw a bunch of pills at you instead of telling you, you know, how to actually, live healthy and get your body back right and all that stuff. So I had a radiology. They did a test, right? They did tests on me. Now, mind you, and this is all going to come into play, okay? Because like I said yesterday, I was about to, I I almost passed away yesterday. Okay. So you guys wouldn't be talking to me today. But so I go in, this is on 1/8 of this year, 1/8/25. So this is what the radiology report says, because they were telling me that they couldn't find anything wrong. So it says clinical history, which is, you know, clinical history. I told them that I have been dealing with, my knee from the accident that I had when I was younger, and then when I got ran over when I was younger. So I thought, hey, maybe that is what's bothering me now. So I go in and get it checked. So this is what's his name? So they didn't do any comparisons or anything like that, but this is their findings. 3 views show the alignment appears anatomic. Hello, Chris Lucas. On here talking about what happened to me. Yes, I might get into my regular live shows. So this is what they say. They say 3 views show the alignment appears anatomic. No erosive lesions are seen. No focal or acute skeletal abnormalities are present. No significant soft tissue swelling is seen, which I did have. No focal acute skeletal abnormalities of the right ankle. Sorry about that. Minor issue with my connection, which I don't see why I've been having these connection issues lately, but I got an idea what's going on. So anyway, so this is what they say. Chronic knee pain plus 15 years. Yeah, you're like a few seconds behind, Lucas. I'm gonna try and see if I can find somewhere better. Um, let me see. All right, let me see if this is man, I gotta get my laptop to see if this live is lagging or anything like that. But so it says, talking about my chronic knee pain for 15 years. It says 3 views show mild osteopenia. The alignment is anatomic. The joint spaces are maintained. No erosive lesions are present. No skeletal abnormalities are seen. An oval oscular focus of 11 millimeters in length with a height of 6 millimeters projects in a I don't know how to pronounce that, joint space laterally. I don't know. I don't know this word, but So they say there's an apparent oscillating body loose in the superior joint space. Okay. So that's what I went in for. So they then gave me this. Um, they gave me some crutches. So actually, yeah, that was the day I think they gave me crutches because I was working. So that was January the 8th, right? January the 15th, I go back to get seen again because now it's getting worse, right? So now they say it's acute pain of the right foot. So now it's progressing, right? So what they did was they prescribed me hydrocodone, Narco 5, and ibuprofen with prednisone. Okay. Now, prednisone has side effects. Now, like I said before, their lab test shows that I'm healthy. Everything about me is normal. Everything. I have no history of high blood pressure. I have no history of diabetes. I have no history of cancer. In fact, they didn't find anything wrong with me in all these tests, which I'm going to read about. But prednisone, they gave me the prednisone, and it's supposed to be a anti-inflammatory steroid, right? So I take it for a few days, and it had me shaking, uncontrollably, like I was having a seizure. So I go back in. Well, let me just, yeah. So they give me this, right? They gave me that. And then they took more x-rays, right? So pain, right foot, comparison. Prior radiographs, including 5/21/24, this was why I went in, 108 findings. Examination degraded by suboptimal positioning, no acute fracture or malalignment, possible cortical sclerosis. So the first thing I went in for was a simple toe, right? Then they said I had, this oscular loose body in my knee, which I already knew about, right? I already knew about that. That's what was bothering me for these 15 years. So now they do another one, right? Now, mind you, in that report where I just read from the 8th, they said there was no swelling. Everything looked fine with my foot. Was the 11 centimeter by 6 centimeter oscular loose body, which I knew about. They said that wasn't a problem. Okay, so now this is what this report says. Impression 1. Oh, wait. It says examination degraded by suboptimal positioning, no acute fracture or malalignment, possible cortical sclerosis along first MTP joint versus summation artifact, no acute soft tissue finding. And then it says impression. Number 1, possible first MTP arthritis versus artifact. Okay. They said it's possible. Okay. I don't have arthritis. The doctor already ruled that out when I went back. Otherwise, no acute finding on current exam. Number 3, correlate the point tenderness and range of motion. Report generated using the assistance of voice recognition software. Occasionally, transcript errors occur. If significant or otherwise, and change to a report is desired, please contact the imaging, blah, 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 blah. So history is right leg swelling, multiple transverse and longitudinal. So they're doing they're saying everything was normal. Everything was normal. Says common femoral vein, and popliteal veins. Said venous structures identified and cleared. Calf veins were surveyed when feasible with no oscillative thrombus identified. So that's like a blood clot in your leg. And it says superficial extremity veins, not fully assessed, but visualized portions unremarkable. No palpable fossa cris found identified. So fossa cris is what they say causes arthritis, right? So they said that wasn't found. No sonographic evidence of deep venous thrombosis. Okay. So that now they give me they didn't give me nothing for that. Now, next trip after the 15th was on the 16th, the very next day. This was when they gave me the prednisone, and I was taking it for a few days. And remember, I said I have no history of high blood pressure. They ran tests on me, everything came back normal. So now on the 16th, my diagnosis after taking the prednisone was chronic pain on right foot plus elevated blood pressure reading. So my blood pressure rose after taking that. So then I go and do another follow-up, right? So then they give me they gave me this pain medication again, right? So it says possible side effects. This is a non-opioid NSAID. Is like it's anti-inflammatory drugs. TT, please don't start, bro. Please don't start. I'm on here talking about how I almost died yesterday, and you coming in here talking about my false teacher, bro. Get out of here. So they give me this, right? And they tell me about these side effects. Now, one of the side effects of prednisone is it'll raise your blood pressure. It gives you spider veins, which contributed to me ending up with varicose, right? So the medicine tangled my veins up in my foot and my leg, and then it spread throughout my body, okay? So that's what I went in for. Now, after the 16th, I go in again on the 18th, okay? For the same thing, for the same original thing, which they discharged me. They gave me a walking boot, told me stay off my leg, ice it, blah, blah, blah. Okay, follow instructions. Now, next visit, 120, 2 days after, I go in again. Now, this one isn't even related to the original problem. This is when the prednisone had basically almost caused me to have a seizure. Okay, so I had a seizure and I had to call them and go in again. So I get checked out and they said now that I have tremors of the nervous system. So I'm talking to the doctor and I'm telling the doctor what's going on and whoa. And the doctor asking, why did they prescribe you prednisone? I said that they said that this first they tried. Okay, so long story short, when I first went in, they tried to say I had gout. That was ruled out. Next time I went in, they said I had arthritis. That was ruled out. Right? So now I go in here and now I have tremors of the nervous system. So the prednisone rose my blood pressure so much to where it swelled up my leg, it tangled my veins and started cutting off my circulation. Okay. So they go and do the tests, right? They give me another, they do a few more tests. So this is what they did. Okay. So radiology resorts, I had a CT scan on my head. They tried to say I had a headache, didn't have a headache. So it says images were obtained of the skull base to the vertex at 2.5 millimeter slice thickness without the use of intravenous contrast, CT dose reduction technique by automatic exposure control and adjustment of the MA and KV according to the patient's size, radiation dose, and then they go in here and they say findings: the ventricles are normal and symmetric. There is no mass or edema, no hemorrhages seen. The paranasal sinus or whatever that is were included, are clear, as are the mastroids. No skull abnormalities are seen. No acute intracranial abnormality. So then they get get some lab tests, right? So I'm gonna read off the lab tests, right? So my UA was clear. My UA Billy negative, blood negative, color yellow, glucose negative, ketones negative, nitrate negative, pH level at 7.0. Normal range is between 4.5 and 8.0. Protein negative. Then they give me drug screenings. Cocaine negative, barbiturates negative, benzates negative, cannabis positive. Yes, I do smoke weed. Yes, sometimes, occasionally. Opioid screen negative, PCP screen negative, methadone negative, spec graph normal. Everything was negative. Okay, so there's nothing that was wrong with me, but their medicine they gave me, right, the prednisone. So I come back home 20th, right, get off my feet, stop taking the prednisone like the doctor said, and then I go back because now it's getting worse because this is when my veins got tangled, right? So I go in, they say the same thing: foot pain, chronic pain, blah blah blah, right? There was no test done on this that I know of. Oh yeah, lab results. So AGAP normal range, BUN normal, calcium normal, chloride normal, CO2 level normal, creatine normal, glucose level normal, potassium level normal, sodium level normal, BCR normal. So everything was normal. Nothing wrong. No history of high blood pressure, no history of diabetes, no history at all. I was healthy as an ox. Okay. So they did this other test, hematology. Everything on that is normal, right? Everything normal. Right. So come home again, send me home again, gave me some more meds, told me stay off my feet, do that. Now we get into the 29th. That was on the 23rd. So 6 days later, they diagnosed me with bronchitis, right? They diagnosed me with bronchitis, and I didn't even have bronchitis. That's the funny thing about it, right? I told them that, I kept telling them it feel like my veins is tangled and it's cutting off circulation, and at night I can't breathe. It's hard for me to walk, blah, blah, blah. So this is after all they gave me, all these medicines, they gave me the crutches, they gave me the boot, So I'm like, okay. Yesterday morning, woke up, right? Sat here normally, watching TV with my mom, had my foot in the boot, trying to, get my foot and my knee back together. And I started feeling like tightness around my chest, right? So I'm looking at the checklist they give you, to, you know, when I identify a heart attack or a stroke, right? So I was having signs of me either having a heart attack or having a stroke, right? So I'm sitting there and I'm like talking to my mom, like, I don't know, you might have to call because I might have to go in because I can't breathe really like that, right? So I'm like, just wait until I tell you to call. I'm just gonna tell you to call if I can't, if it get worse. So it got worse, and I told her to call. So she called, the ambulance come. Now, mind you, these people that came and picked me up like 6 or 7 times this month alone. This is the most, this is the most I've ever been in the hospital in my entire life, right? So they come, when they get here, I can barely breathe, I can barely talk. So I'm trying to keep my head up, trying to turn and get in the right position where I could breathe. They keep asking me questions. They know I can't talk because they see me gasping for air and everything. So, you know, they get me on the gurney, and this is where I'm like basically, you know, gasping for air, right? So they take me in the ambulance. Now, mind you, there's no circulation in my arm. So they take me in the ambulance. They put the damn blood pressure, the little thing that squeeze your arm to take your blood pressure, right? So they put that on me, and then I felt like it was cutting off more of my airway. So I'm like, take it off, take it off. And he take it off. And right when he took it off, everything just shut down, right? And my vitals spiked, and I went red, and they drove off and took me to the hospital. Okay. The whole time I'm in the back, they trying to ask me questions and stuff like that. And I couldn't answer. I couldn't give one word. So they take me in there and they talk to me. I couldn't barely even talk or anything like that. So I go in there to give me a breathing treatment. But when they was taking me in the hospital, I actually passed out on the stretcher going into the hospital when they hooked me up, and they said we're going to run some tests on your heart and everything. They put the things on me, and I went red. Okay, because it wasn't no blood flowing, it wasn't nothing going on. Okay, so they, you know, doctor come in, he asked me why I got the boot on, and I'm trying to tell him, but I can't breathe. So he like, you could type it if you want, if it make it easier. So I try and type it out. Couldn't do it because ain't no circulation in my fingers. So I can't move my fingers. So now I feel my body getting cold and everything like that. And, you know, they taking a while, they sweet dear old time to go, you know, talk to the other doctor. The other doctor come in and say, you know, the other guy told me to come in and give you a breathing treatment. This is going to be for about an hour. So I had to spend an hour in there. And the whole time I'm in there, I'm just like, God, please just, you know, just, you know, let me get up out of here. Let me walk out of here or something. Cause, you know, the way I was feeling, it was like, you know, I thought it was my last day, uh, really. But yeah. So that was yesterday. So on their reports, they basically say everything is fine, man. No, I didn't look. Okay. When you play the video back, I'm reading through all the reports. There's nothing wrong with me. Okay. The only thing I went in for was a pinched nerve. That was on 5/21. Then it got worse. My foot and my legs start swelling up. Okay. Then you know, I kept going back because it kept getting worse. Then they gave me the prednisone, which rose my blood pressure. And then, like, okay, let me do this. Give me a second because I'm gonna read to you guys the side effects of prednisone, and you'll see exactly why I started having all these problems in the first place. Where's my charger here? So I'm gonna read to you guys, but they didn't say I had pneumonia. They said I had bronchitis, and that was later ruled out in my follow-up. when I went in, they said, well, we don't see signs of you having bronchitis. But they said it was something going on with around my throat area or something. But like I said, when they gave me the prednisone, it rose my blood pressure, and then it tangled my veins in my foot and my leg. Hold on, I'm trying to sign in to my Chromebook. Hold on. Because I'm going to read to you guys. Yeah, to you guys. So, remember, I read my reports, and they said everything I'm normal. Glucose is fine. I don't have high blood pressure. I don't have high sodium count. Everything with me is normal. Healthy. This is what this like the prednisone. Let me turn on my hotspot real quick. 1 second. I know that if they're trying to put you on prednisone, don't take, not take it. Don't take it. So this is the side effects of prednisone, right? And this ain't gonna be a long live. This one. But like I said, I have a software and I already know what's going on. I know who's doing it. So, you know. But anyway, so this is the side effects of prednisone. Weight gain, high blood pressure, cataracts, mood changes, delayed wound healing, fatigue, sleeplessness, which is what all the stuff I was going through. Acne, I didn't have that. Headache, I didn't have that. Indigestion, osteoporosis, sweating, dizziness, blurred vision, swelling. So they give me prednisone for my already swelling leg when one of the side effects of prednisone is swelling. It also causes irregular heartbeat, increased hair growth, for women, irregular periods, irritability, which I was very irritable, edema, thin skin, appetite changes, cough or hoarseness, which is why I went in yesterday, because the prednisone caused that. Well, Pam, yeah, I know I'm all good now because I called out whoever was doing it. That's why. Yeah, I know, Pam. I was looking at the research on it. But the reason why, so I'm gonna go through this real quick. Okay, I went in for a pinched nerve on 5/21/24. I didn't go back until 1/8 of this year, right? This month. I've been in the hospital. Let me see. 1, 2, 3, 4, 5, 6, 7 times this month alone, from January 8th all the way up till yesterday. So the prednisone gave me varicose veins. Now, if you don't know what varicose veins is, it's when your veins get tangled and it cuts off the circulation in your leg and your foot. And that's what I originally went in for. Now, these people told me I have everything else, but I'm telling them about what's going on, and they telling me it's everything else. Search on veins. I told them my veins tangled after they put me in that boot and made me prednisone. So the doctor, I stopped taking prednisone like after 2 days. The doctor told me why they gave it to me anyway, right? So they misdiagnosed me with gout. Then they misdiagnosed me with arthritis. Then I had tremors of the nervous system because of the prednisone. Then okay, so then they said I had bronchitis, right? I didn't leave, my connection keep dropping, but they said I had bronchitis. I don't have bronchitis. That was also ruled out. So they misdiagnosed me 3 times, right? They misdiagnosed me 3 times. So now I have to go and talk to a lawyer because all the stuff that I had to go through, going to this hospital, right? So I almost died yesterday, and I was just checking in with you guys, let you guys know I'm all right. I've been wanting to come on here and get back into my live studies, but it has been a very, very tiring month. I have not gotten any sleep this month at all, right? So this is what happened, right? So I look up varicose veins, and I'm like, okay, what could I get, to at least deal with it? So instead of these people telling me when I told them my veins felt tangled, instead of them telling me to go buy compression socks to improve my circulation, so recently I lost my job. Right now, this is fascinating, right? Because the whole time I'm going through all this, I'm just praying, and I'm asking the Most High, like, man, just like, please help me, do something, heal me, do something. These people ain't helping me. I feel like I'm about to die soon, and all this stuff was going on, and I was getting depressed. I was going through it. So I called my brother. Actually called my brother. Me and him don't really talk, but called him and I tried to see if I get some help getting my socks, right? Because I just recently lost my job, right? So I have no money yesterday, none at all. So I get back from the hospital after almost dying in the hospital, and I come home and I'm trying to figure out, man, who could I call to see if I could borrow something until my taxes come, I pay them back, and all that stuff. And I ain't forgot about none of the other people that helped me. I will get whatever I can get back to you guys as soon as possible. But so I'm sitting here, I'm like, man, how am I going to get these socks? So I go and I look, and a little alert popped up on my phone, right? And it was basically, I had a subscription that was on hold because I didn't have no money to pay for my YouTube subscription. So out of nowhere, my YouTube subscription was paid. I said, "Huh, that's weird. I don't got no money in my account because it was negative $5 because of the fee they charge you for using the service or whatever." So I had $66 from my job that already gave me my last check 2 weeks ago, right? So I'm sitting here. No, they gave that to me 2 weeks ago. I haven't been working for 2 weeks. I have not worked for 2 weeks. They already gave me all the money that I had. But out of nowhere, and this wasn't even through Trio, it was through the parent company, Elier. Elier, the company that's over Trio, paid me $66. And I was like, that's the most high right there, because I was just trying to figure out how to get these compression socks so that I could at least alleviate the pain, because I was in so much pain. Y'all just don't understand how much pain I was in, and this medicine was messing me up, and the prednisone they gave me, and you know, I will say this though, when I felt like I was about to die, I mean, really, I know everybody say they have these NDEs and they see all this stuff, but seriously, when I went out, all I seen was dark. You know, everything was dark, and peaceful. To be honest with you, I felt like relieved, like relaxed kind of thing. But I didn't die. I went in the red, but I didn't lose. I mean, I was in and out of consciousness, and my vision was going in and out, but you know, but for the most part, it was like this peace. It was like I was in a state of peace, right? So that right there, you know, was like, yeah, that's the Most High looking out for me. And I knew it was him because I knew it was him because out of all the stuff that I was going through, and I go and look up what was going on with me. And then when I bought the compression socks, overnight, I kid you not, overnight, all the circulation went back into my body. All the blood started flowing back in my body. You know, because the compression socks is supposed to, you know, basically help your circulation, because that's what I was having. I was having problems with my circulation due to my veins being tangled because of the prednisone. So I just wanted to go and get on here and do a quick check-in with everybody, because to be honest with you guys, I thought I was going to be dead today on my birthday. I really thought I was, just based off what happened yesterday. And this is why I say I don't go to hospitals. They're not designed to heal. They're not designed to cure. They're designed to keep you sick, to keep you injured, so that you have to keep going back to them so they can keep racking in their money. Because like I said, God forbid, if they were to heal every person that came into their establishment in the hospital and side effects to anything, or if they gave people alternatives instead of throwing pills at them as a problem solver and said, hey, you know, Melvin, you said you have tangled veins. We would recommend you go and get compression socks, walk regularly, start off slowly, stay hydrated, elevate your legs for blood flow, and keep a healthy diet. And if anything gets worse, come back and we could see what other options we have for you. No, the first thing they do is throw a bunch of pills at you that cause a bunch of other side effects, to where you have to go back for a bunch of other stuff, Hence, I only went in for toe pain. Then it turned into chronic foot pain and knee pain. Then it turned into acute foot pain, knee pain. Then it turned into tremors of the nervous system. Then it turned into bronchitis. All in 1 month. So this is why I say I try to stay healthy as possible so I never have to go to a hospital. This month alone, I've been in the hospital more than I have ever been in my entire life. But this is just a quick check-in, let you guys know what's going on with me and why I haven't been live, because I told you I was going to go live, but I've been just dealing with a whole bunch of stuff in my personal life. And all I'm asking is, keep me in y'all prayers, man, because I don't know right now, to be honest with you. So I'm going to try and get back to, covering some stuff. We got some good stuff coming up, man. I'm trying to get some stuff put together. I've been watching a whole lot of stuff going on. Quite frankly, lately, the Most High has not been leading me to come do any lives, because all my lives, if you haven't went through my channel, go through my channel. Look at how many videos they pulled down. And most of the videos, I find ironically, that I was talking about with the AC has been pulled down. And I'm wondering why. Why did they pull down all those videos with all that information if I wasn't spreading medical misinformation? That's what they said I was spreading. But I didn't get not one strike for anything. Any of the videos they took down, I didn't get a strike. Not one. They took down 5 of them. Just took them down, removed them. So that's another reason why I haven't been on here, because I find it very odd that you could talk about anything. You could show on YouTube people getting killed. You could have all this other stuff on here, all this violent stuff on here. But as soon as somebody talking about anything biblical, it's like, oh, you got to avoid that, right? Got to avoid that. There's been a lot of stuff that I've been seeing going on YouTube. There's been a lot of stuff I've been seeing. It's a lot of stuff. I've been going to people's channels too regularly. People might not know I be in there, but I be in there. I be just sitting back watching. Right. So there's the Most High at this point. He just got me on watch status. All the stuff I said basically back then, those videos have been taken down, and I got them recorded, but I can't post them up again. So that's it. That was the last straw for me. But entwine the mind. I'm not afraid of nothing. I'm not even afraid of death. Yesterday, like I said, if it was my time to go, it was just my time to go. But it wasn't. I'm sticking around until the very end. Until the madhouse fall down, that's when I'm leaving. Most High ain't done with me yet. But I will try and get back to my live shows. This wasn't really a biblical discussion, so I don't know why ETT came in here talking about I'm a false teacher. The guy that teaches that sleeping with underage children is okay, and you speak blasphemous stuff, and you butcher the scriptures. You don't keep anything in context. You don't read word. And this is another thing that really irks my nerves. Everybody read all these books. You read a novel, you read a magazine, you read, a child's book, you'll read something that your favorite author wrote. And it's like, you read that and their words are what they are, right? Their words are what they are. But when it comes to the Bible, everybody want to reinterpret the Bible. right? Everybody want to explain what the Bible say when the, like, for instance, right? For instance, if somebody believes that we're supposed to obey everything that the Most High said to be obedient children to Him, right? If we're His children, we are supposed to obey every command that He gives us, regardless of if it's in the Old Testament or if it's in the New Testament. And I'm not talking about Levitical priesthood stuff. I'm talking about moral guidelines, guidelines to give you a healthy eating lifestyle, guidelines to keep family relationships together, stuff like that, right? You read this stuff, right? And it's like, oh, it doesn't mean that, it means this. No, it means this, right? And then you got people like our favorite guy, Perry, the preacher, who will go to all the verses about sin, but he won't go to all the other verses, that speak about anything else, right? And his whole thing is he's playing the devil's advocate of, I'm going to accuse everybody of being a sinner because I'm a sinner, right? That's his MO. What I do is not a sin for me, but at the same person, it's a sin for them because they're not doing sin in the faith of Christ, which makes no sense because Christ never walked around teaching that. Christ didn't tell nobody, go live the way you want to. All you got to do is just believe in me and you're okay in the judgment. Because at the end of the day, he's the one who's going to judge us. It's not his father. His father gave him power to judge. He's going to be at the right hand of the throne with the books open. And that's all that is. If you ever want a intelligent discussion, because I don't do debates, we have discussions here. In the book of Romans, chapter 1, it strictly forbids that you have debates. Yet all these Christians, alleged, are holding and hosting debates. I don't do debates. I do discussions. Only debate I ever did was against Perry, and that was to call him out on his false teaching. But that's that. So I just want to, give you guys a rundown, let you guys know. Well, Entwine Mind, time to get ready. This is why I tell people all the time, man, if you get ready, you ain't got to stay ready. You ain't got to get ready, right? Because we don't know when our last day is going to be, right? Tomorrow I could walk outside the door, get hit by a car. I want to make sure I'm ready for that day when I do. So, all I do is just sit in this house since I don't work anymore, still be reading my Bible, talk with my mom. Just ain't been doing the live shows because Most High ain't been leading me to do nothing. That's why I haven't been on Nick channel. That's why I ain't been on Ryan's channel. That's why I ain't been on nobody channel. Y'all haven't seen me because the Most High ain't leading me to do this no more. He ain't. I've said all I had to say, but I will still come on and try and do a couple of sessions. But for the most part, I'm just watching right now. Because like I said, 2025, I told y'all, man, Trump was going to get back in. I told y'all, too, that it's going to be revealed that Trump might be the Antichrist. But we'll see. All right, man. You go take care of your family. Oh, I thought you said you was leaving. You don't meet the best Christians on the internet. I recommend going to a church if you don't already. See, Entwine mine, I guess I'll stay on and chat with you guys since I ain't talk with you. This is gonna be just a chatted up discussion, I guess. But I've been in a lot of different churches, a lot of different denominations. I don't attend church. We are the church. Church ain't a building, right? You are the church. You are the temple of the Most High. The Most High is dwelling within each and every one who believe in him. You don't got to go and step in the building to go and worship God. You don't. And to be honest, all these different denominations only talk about what they believe in. Even though it might not be scripturally sound, they'll just pull verses here and there. Like I said before, the oneness will pull verses like me and my Father are one, and they'll say, see, well, Christ is the Father. Then the Trinitarians will say, they'll use the Trinity verses, and then the sinless perfectionists, they only talk about the sin in the Bible. They don't read the whole thing and go through the whole book and actually read book by book by book by book, chapter by chapter by chapter by chapter, the whole thing in context, because it's basically from the beginning, the Most High's plan from the beginning to the end. And I'll never see a change in his plan. I don't. I mean, if it was okay for them when Christ came to just, change. And this is one thing that people don't understand, right? When Christ said, I'm the way, the truth, and the life, if any man will come after me, he will, first deny himself, pick up his cross and follow me, right? So why would he tell people pick up their cross and follow him? And when Christ was walking this earth, he was doing what his Father said. He didn't do anything separate from what his Father said. But all of a sudden now he's risen again and he's sitting at the right hand. Now it's okay to just disobey. Don't get it. Oh, I'm not saying that. Of course, there's a lot of good people in church. What I'm saying is this. Okay, I've been to the Mormon church. I've been to a Lutheran church. I've been to a Baptist church. I've been to a Pentecostal church. Everybody's reading the same book, but everybody has all these different views. Okay. So like when Paul was saying, some say I am of Paul, I am of Christ, I am of Cephas, and all these other people. He's talking about different denominations. And then he says, is Christ divided? Is he divided into oneness? Is he divided into Pentecostal? Is he divided into all this other denominations? Or is everybody supposed to be on the same accord if they're following the same person? That's what I get out of that. Okay, it's common sense, right? Everything Christ said wasn't a mystery. They might not have understood it, but he always gave them the understanding when he explained stuff to them. Another thing I found funny that I learned recently about the human body, and I'm just going I'm gonna throw this out there, right? The Most High, man, the Most High, the Most High he's a very, very, very wow, I don't even know how to say this. Let's say that he created everything perfect, right? He created us as humans perfect, right? When we come out the womb, we're perfect, right? Our body, we don't have no injuries, no nothing. But during our life, we come across stuff where we get injured and all this stuff, right? So I was just thinking, because when I was going through this stuff with my foot, right, and the circulation problem, um, if you guys don't know, and I'm gonna tell you this because it's gonna help you, it's gonna be a real good benefit to your health. Okay. If you guys don't know the importance of your feet, right? And this is going to go into what Christ did when he was washing their feet, and he said, "You don't know what I'm doing to you, do you?" Um, so I found this out, right? So you got everything that goes on with your body starts in your feet. Okay. So if you guys go and let me just do something. I'm gonna show y'all something real quick. Hold on. Give me a second. I'm gonna show y'all something. Or I'm gonna read this off. Hey Carol. On here telling people about yesterday and going into stuff. And also giving you guys some helpful tips about um relaxation, right? Because when I really do believe this is why Christ was washing their feet like that. When he was washing their feet and he said, "You don't know what I'm doing." He said he told them, "You don't know what I'm while with me washing your feet, right?" So I figured this out, right? The importance of your feet, because if you don't know this, this is very important. Focal points on the foot, right? And you're going to find this fascinating. I'm going to tell you guys something, and I want you to actually try this, right? Gently massage your foot going from heel up to your toes, right? Just like give it like one or two good rubs, right? Going up from the heel to the toes, right? And I'm telling you, if you got back problems, if you got like hip problems, if you got, you know, headache problems or anything like that, it actually relaxes your body. It actually does. Because if you guys don't know, everything about your body is connected through your feet. Your feet are very, very important. Okay. So I'm gonna show you guys this chart, right? Trying to turn my camera on. Let me see real quick. And where is this thing at? All right. All right. So let me turn this on real quick. See this? Lower back, hip, knee, ankle, foot, right? This part right here controls your um ascending colon. Then you got your bladder, your adrenal glands, your shoulder. Oops. What happened? Oh, stomach. Your sinuses are in your toe. Your big toe is for your brain. Underneath is for your neck. This part is for your shoulders. You got your bladder over here. You got your pancreas over there, adrenal glands, liver. So everything about your body is connected to your feet. Your kidneys, your transverse colon, waistline, liver, bladder, spleen. So when I was going through this stuff with my foot, right? So doctor, when I was telling him before he put me in that boot, um, he had grabbed one of my foot. He didn't grab my right foot because it was swollen. So he grabbed my left foot and he was like, he touched my foot and he was like, "Oh, you got pretty good blood flow." And I said, "Yeah, because you touching the focal points on my foot and it's relieving the pressure." So basically, when he was washing their feet, when he went down and he was like washing their feet, I think that's what he was doing. He was relaxed. Back then, I don't think they had any proper shoes, thing like that, or anything. I don't know, but it's a reason why he was doing that. But I noticed that was the first thing that came to my mind when I was like, so is this why Christ was washing his disciples' feet? Because he was actually giving like when he was washing their feet, with his hands, he was basically massaging their feet too. So he was massaging their focal points on their feet, which relaxes your body. It gets you won't feel tension, you won't feel nothing. I mean, your foot will be happy too. It's going to do a little happy jump when you do it too. So that's if if your feet are aching, massage them. Go from heel all the way up to the toes, and I guarantee you're gonna feel so relaxed. You're gonna be like, wow. But yeah, that's just a little health tip. Everything that deals with your body starts at your feet, right? So healthy feet means healthy body because everything's attached to your foot, just like everything's attached to your brain. Your brain are the most important things next to your heart and your lungs. Can't live without those four things. Well, you could live without your feet, but who wants no feet? I just turned 36 today. Today is my birthday. So, and not only that, let me bring that up because I don't think that was anointing. I mean, he could have been, but what I think he was really doing was a massage, giving him a foot massage because he was asking, and he asked them when he was washing their feet, "Do you know what I'm doing?" Let me bring that up real quick. Let's read that real quick. Since I got a little bit of time, let's get one Bible verse in before I go, or scripture. And yeah, let me see. Let me see here. Yeah, I know, which is why I was wondering. Well, I already knew, but this is why I said I'm healthy as an ox. So all that stuff they were telling me in the hospital when they was diagnosing me with all this stuff, when they diagnosed me with all this stuff, and I almost died yesterday on their gurney, you know, I was thinking to myself, they're reporting all the knocks, but they're diagnosing me with stuff like bronchitis and uh, tremors of the nervous system after you gave me that prednisone. And I kept telling them I had poor circulation, and they just kept overlooking that. No, it's gout. No, it's arthritis. No, it's this. No, it's that. And overnight, I put on compression socks, and everything goes away. All that stuff they said goes away. I'm able to walk. I'm able to breathe. My back ain't hurting no more. My stomach ain't hurting no more. My legs ain't hurting no more. My neck ain't hurting no more. I ain't feeling dizzy no more because it was a circulation problem. But they wanted to misdiagnose me with everything else. So right now I'm in talks with a lawyer. So Entwine mine. My iron levels are very great. Okay, let me just read to you again the report. Okay. This is the lab reports, right? When they did the CT scan, they did blood work, they did x-ray, they did radiology, they did every test known. They gave me drug tests. Okay. There is nothing wrong with me. The only thing that's wrong with me is when they gave me that prednisone and it tangled up my veins, it cut off my circulation, which almost killed me. So let me show you my lab results real quick. Here you go. Lab results. Urine studies, clear, negative, 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 normal, negative, normal, negative, negative, negative. Positive because I've been around people that smoke. Yes, and I smoke too. Smoke weed sometimes. Yeah. Negative for PCP. Negative for methadone. Negative for spec. Normal, actually. Negative for infinity. Negative for fentanyl. Okay. Other tests they ran. Blood work. Let's see what they say about my iron levels and everything. Here you go. More lab tests they did. Normal, 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 normal. Everything is normal. So I'm healthy as an ox. It was their medicine that almost killed me. That's what my lab tests say. Iron levels fine. I don't have high blood pressure. I don't have diabetes. I ain't got nothing going wrong with my health whatsoever. Never had a history of high blood pressure. Prednisone gave me that. Oops, sorry about that. Sorry about that. But how did that lab say that I'm healthy? There's nothing wrong with me. Yet they're diagnosing me with stuff, bronchitis. Everything but I was for pinched nerve in my foot. Now, does it sound like I have bronchitis, guys? I was diagnosed with bronchitis yesterday. When I went in, I was wheezing. I couldn't breathe. I was hacking and coughing. As soon as I wore compression socks, everything went away. Because it's a problem with my circulation. It's not nothing else. Because their prednisone tangled up my veins. Because prednisone, one of the side effects of prednisone is spider veins. And if you look up spider veins, they are a smaller version of varicose, which is at the source, your foot or your leg, which can then, if left untreated, spread throughout your body, which is what happened to me, which is why my circulation was cut off and I couldn't breathe yesterday, which is why I almost died on their gurney inside their hospital yesterday. Because their so-called medicine gave me high blood pressure, tangled veins, and a host of other side effects that I didn't even want. I only went in for simple toe pain, for a pinched nerve. And within a month, I've been diagnosed with chronic pain, acute chronic pain, gout, bronchitis, and tremors of the nervous system, all in 1 month. Blood sugar is fine. I don't have a history of diabetes. Everything is normal. I'm gonna read it off for you guys again. Lab results. Chemistry, AGAP normal, calcium level normal, chloride normal, CO2 normal. In fact, it's at 28.0. Normal range is between 21 and 32. Chloride level is at 107. Normal range 98, between 107 and between 908 and 107. Normal range calcium. My calcium level is at 9.4. Normal range is between 8.5 and 10.1. My bun level is 12 mg/dl. Normal range is between 7 and 18. My creatine level is 1.13. Normal range is 0.70 and 1.30. My glucose level, that's dealing with sugar, 89. Normal range between 74 and 106. My potassium level is 4.0. Normal range 3.5 to 5.1. Sodium level, this deals with your high blood pressure, 139. Normal range 136 and between 136 and 145. So I am healthy. Nothing. It was their medicine. My neutral auto is at 45.2. Normal range is 37, between 37 and 80. My MCV is 83. Normal range is 80 to 97. My limp auto, normal, is at 45.6. Normal range is between 10 and 50. My platelet, this is dealing with your blood. So this is like if you got any like blood disease or disorders or anything like that. My platelet level is 223,000. Normal range is between 142 and 424. So all this stuff, all these tests they ran on me turned up. I'm healthy as an ox. So why is it that I had tremors of the nervous system and then was diagnosed yesterday with bronchitis if I have a clean bill of health? And all this stuff didn't happen until I took their prednisone. You know, common sense to me says they did that to me and I almost died because of what they did. Because I only went in for a pinched nerve. And they tried to tell me it was gout, which was ruled out. They tried to tell me it was arthritis, ruled out. And then they gave me the prednisone, which caused more problems. So now I got to deal with this, right? So, like I told y'all, I try and stay as healthy as possible. Only thing I might do is I might smoke a little bit. That's it. And even then, my oxygen level is perfect. No cancer, no nothing. Nothing's wrong with me. So this is what I've been going through for this month. This month has been a living hell for me. 2025 is not a good start. So I just want that, that's the whole thing. This is why I harp all the time about how people should never go to the doctor. You really have to, unless you're on your deathbed. I wouldn't recommend going to a doctor because they're just going to prescribe you, like I said before, prescribe you medicine that's going to make you worse. Now, you guys could say it's medical misinformation, but I showed my lab results. And I'm giving a testimony about what happened to me. So YouTube, I already know you're going to take the video down because you're going to classify this as medical misinformation. But that's okay because I got other platforms I can go through to talk about this. So it is what it is. I'm already ready for YouTube to take this one down. So guys, when you see this video removed, you know why. Because God forbid if you speak against the that many visits. If they actually heal people and cure people of every disease and ailment, then back to their hospital. But that's not how they make money. They make money off you going in, not staying out. And that's the truth. And if you don't like the truth, I don't know what to tell you. Just look. Even well, let me get on to this original thing that I was about to do. I almost lost track. Forgot I was supposed to be bringing this up about Christ washing the feet. So let's get into that before I go. And take note of everything. You guys might want to try and download this video before YouTube take it down. You got 24 hours to go back and watch my video and take note of the health tip I gave you guys. I'm waiting for this to load real quick. Just give me a second. Oh, my connection has been so crappy lately. That's why I ain't been going on nobody lives anyway, because I'm not going to go on nobody live and keep dropping. I don't have time for that. So, you know, that's why I don't go on and keep acting funny. Even my phone, on Wi-Fi, everything just keeps dropping. Like miraculously, everything just shuts down all the time. But it stops. So that tells me something. Even my reports on my phone tell me. But anyway, Christ washing the feet. So it says, now for the feast of the Passover, when Jesus knew that his hour was come, that he should depart out of the Father, having loved his own, which in the world, he loved them unto the end. So, so him, and Peter said unto him, Lord, dost thou wash my feet? What I do thou knowest not now, but thou shalt know hereafter. Peter said unto him, thou shalt, if I wash thee not, thou hast no part with me. Right? But I think it was also another thing, because Peter asked him, why didn't you go, wash my hand and wash my hands and my head? He said unto him, Lord, not my Yeah, I'm gonna go on ahead and get off here because obviously I can't do this live in peace, which is why I'm never jumping on anyone else's live show because I'm just gonna jump off. But go read John 13 and you'll see what I think it was. Mean was watching. Why only the feet? No, I think it was an important thing about that part of the body, which is why Peter asked him about washing his hands and his head too. But anyway, let me get out of here because I already know this is going to shut down again. And I'll try and do another live soon if I can, on my channel. If not, then, I will be giving the information through Discord, Facebook, or whatever else, because you're not stopping the message no matter what. Shalom and have a good day, everybody.